Conventional wisdom was that the elderly were most at risk to get really sick or worse from COVID-19. And while that may still be the case, there are these troubling new reports about a mysterious syndrome impacting children, possibly linked to the virus. And that is setting off alarm bells with every parent who hears it. And as Stephanie Ramos reports tonight, there is a new global health alert as cases continue to spike right here at home.
Tonight, growing reports of that rare inflammatory illness in children linked to coronavirus. ABC News identifying at least 220 possible and confirmed cases in 20 states, plus D.C. More than 100 cases in New York, where 3 children have died.
Other states should expect what we have seen. We've noticed that it's 4 to 6 weeks after the peak of infections in the state.
The CDC sending that urgent alert for doctors to look out for patients with fever, inflammation, multiple organs involvement, and infection or exposure to COVID-19 within 4 weeks. Today, the World Health Organization sounding the alarms. Brittany Bowler wants to know if that's what sent her son Titus to the ER, starting with a fever.
The second day, he was just crying about his tummy. It was like his tummy was just hurting and hurting.
In a matter of days, her son's fever climbing to 104, and he was vomiting.
His lips were like super red and swollen. His eyes were bloodshot red. He was breathing really fast.
Titus was treated for Kawasaki disease and recovered, testing negative for COVID-19. But his mother now wants him tested for those antibodies. Titus's symptoms strikingly similar to 9-year-old Bobby Deans in upstate New York, who wound up in the ICU, later testing positive for the virus.
If we didn't get Bobby to the doctors within 24 hours of when we did, they said we very well could have lost him. And that's really scary thought for us.
And Stephanie Ramos joins us now. Thankfully, both of those boys have recovered. But Bobby's parents had a message for others. What do they want them to know?
Absolutely. Bobby's parents are stressing the importance of early detection. And the American Academy of Pediatrics, they're also telling parents to be on the lookout for those symptoms, the fever, the rash, the stomach pain. And as soon as they notice those symptoms, they need to call their doctor.
And Stephanie, as a reporter and a parent yourself, this must be so disturbing to cover. What's been the most surprising thing that you've learned as you've been speaking to families this week?
Lindsay, it's been surprising to see how quickly these children become critically ill. So a lot of the parents that we've spoken to said that as soon as their children spiked a fever, they went to that urgent care, they went to their pediatrician's office, and then were sent home with Tylenol. That was the case with the boy in Queens, a 9-year-old boy in Queens. His family told me that days after being home, his fever was improving, but then he went into cardiac arrest. And that's how quickly these symptoms can turn serious. So as Bobby's parents said, they want that early detection. They want parents to be on the lookout for the symptoms so that they don't have severe damage or long-term damage later on. Lindsay.
All right, Stephanie Ramos for us. Thanks so much, Stephanie.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.